McDowell Chamber of Commerce, we just want to take the opportunity to say thank you to be able to come down and welcome MAHEC into the community of McDowell County. We're excited about that. We're excited about some future potential that could happen here with this and things like that are going on. We thank Michelle for taking the time to invite us over and give us the opportunity to welcome you guys to the community. I think it's a great thing what you're doing here, and we always need medical professional, whether it's in the dentistry or in the healthcare. Before I begin, those of you that don't know who I am, my name is Steve Bush. I'm the Executive Director for the McDowell Chamber of Commerce. And with us today we have some very special guests and dignitaries in the room, and I just wanted to take a second to introduce them and make sure that they are recognized. Mr. Chuck Abernathy, our County Manager. Thank you for being here today. Beside him is Mr. Clint Stewart. He's the East Region Chief Financial Officer for Mission Health. He's also the 2015 President of the Board of Directors for the McDowell Chamber of Commerce. Bob, I had it, and now I'm going to mess it up.
That's all right. Just say Bob.
Say it for me.
Bednar.
Bob Bednar, who is the current interim CEO for McDowell Hospital. We're very pleased that he's here to welcome. And we have some board of directors from the chamber. We also have a group with us that is what we call our ambassadors. And they're a very special group of people. We want to thank them especially for coming out. They represent the chamber out in the community. And they're welcoming new businesses. They're coming out to check on you, to check the pulse. And that's something we're very excited about. But without further ado, I'd like to introduce Dr. Jeff Heck, who's the President and CEO of MAHEC, and turn it over to him. So welcome.
Thank you, Steve.
And just before I do that, just a little token of our appreciation. It's something that will help with your teeth, of course, is chocolate.
Sorry, I don't know where it is.
Right? And something else. It is a ribbon momentous occasion as far as the ribbon cutting. And if I can get it out of my pocket without messing up here. You guys have, MAHEC's been in business for quite some time, and what you guys do is phenomenal as far as allowing for continuing education in the health and dental fields. But you're all about community. You're in 16 counties, if I'm not mistaken, so we're excited about that. But you guys are building community through business and different types of, more in the healthcare business more than anything. And so on behalf of the McDowell Chamber of Commerce, turning opportunity into vision, which is something you've done here, we give you your very own golden scissors for today.
Thank you.
So thank you very much.
Thank you, Steve. Thanks.
Absolutely.
Thanks
sir.
very much. And thank you, everybody, for coming out. I want to say a couple of things about MAHEC, and then specifically about this sort of treasure that we have here. The specific thing about MAHEC is MAHEC has been around for 40 years, but in the last 3 years we've taken the charge to actually grow to meet the needs of the community. We said, you know, for us, it's the community first. Our job is really to serve the western 16 counties in healthcare. And in the last 3 years, we've added 108 new jobs and almost $6 million in annual revenues that are really servicing good jobs. I mean, these are not healthcare jobs; are great jobs actually. Mm-hmm. And over that 3 years, we've had a remarkable amount of growth. The thing that's so pleasing to me is that growth has been actually not for jobs for plastic surgeons or dermatologists, and not that they're bad, but you only need a few of those to get to $6 million. But these jobs are jobs in people who are actually doing the work of primary care, general dentistry, meeting the needs out in the community, and it's something that we're really proud of. So I want to say another thing about the dental program here, which is really important. I'm a family physician, and actually I still practice some medicine. I actually see patients out at the Deerfield Community Center. And one of the things that strikes me is, as you get older, if some of you might already experience this, the older you get, the more your teeth, kind of problems you get from your teeth. And one of the things that we have been increasingly noticing in our practice there is that the patients there are really appreciative of the MAHEC Dental Center. And I say dental center, it's really a center for advanced training in dental work. It is a place where they take the toughest cases, they take the most challenging things. I've had some of my patients who have gone to the dental center and have said, I'm 85 years old, I've got a really troublesome mouth, I'm not sure I need to have all this work done that's been recommended to me, give me your opinion. And Ed and his team, as really the experts in the region, have actually come up with the plan at a cost-effective and appropriate way for our patients. And that's something that let me tell you, he's my dentist. That's where I get my care. And I get my care there really because the quality of the service is high, and I feel like, you know, it's the best service we have in Western North Carolina. And one of the things that at least I think you should be excited about is we're bringing it here. This is the first rural area that we're here, and it's really important to us that this is successful. We want this to be a model where we can get the best care possible for dental work in the rural areas primarily. We also were doing the same thing in primary care, the same in obstetrics and gynecology. We have a pretty broad reach. Our principal partners are Mission Hospital. You know, you welcomed us to, I don't know where you are, Steve. You welcomed us to McDowell County. We've actually been here. These practices are actually an arrangement that we have with Mission Hospital to manage the primary care practices in the region. So we're really excited about being here. We're always open to new ideas and new needs. We're open actually to any ideas for growth as well. So I also feel like it's important to thank our dental staff, our dental residents, Libby, who is our overall director of family medicine and dentistry at MAHEC, and Carol Steen, who is our HR director. This is a project that's really important to us. And of course, Michelle. Anything that looks nice, it's always Michelle who makes it look nice. Ananda for your practice here in medicine, you know, and also John, you too, and the whole staff here that I think provides such great care to our patients. So I could go on, but you know, you don't want to hear that. You want the chicken, you can smell it. So I want to introduce Ed Coryell.
So Jeff, I'll relieve you that chocolate since you're your dentist.
I'll probably give me some dental floss.
Okay, all right, you got that extra. So that one's for you, Ed.
Thanks, Steve.
Appreciate it. Absolutely, yes, sir.
I'd like to thank Steve and Jeff for their kind words on there, and we'd like to thank McDowell Hospital, Mission Hospital, the county, for allowing us the opportunity to come in and provide oral health care for this community. You know, one of the things that I firmly believe in is universal health care for everybody. No one should go without. And one of the opportunities we've had through the HRSA grant, et cetera, is to expand our residency, our advanced training. The residents we get come from all over the country. They interview. We have people from the state of Washington to California. They hear about it, they want to come here. And what we want to do is be able to find an opportunity to show them different modes of practice, whether it be in a rural community, whether it be in a city setting, doesn't matter. So this will give us a great opportunity to allow folks that are in the dental profession to see that there are alternative areas to practice in, and then the population over time, we hope that we will populate this area with folks that realize that this is a fulfilling career to have in rural dentistry and rural medicine. So I'm honored to be working with MAHEC because we're on the forefront of that, and I really believe that we're going to, as the years go on, Jeff and I have talked about some future things that may go on, is to see that go out into other areas of these counties. You know, the 18 counties that are in Western North Carolina that are so desperate in need of quality physicians, quality general dentists that will want to have that community sense that I want to practice out there, I want to be part of. And this is our first step, and we're honored, and it's truly an honor, and we take that very seriously, to be a member of this community, and we will give our full effort to make sure that we meet your needs. And if we ever don't do that, I'll give you my personal number, you can call me, and we'll make sure we'll correct it, because that's our guarantee, that's our promise. We're here as healthcare providers to be excellent providers of care, compassionate providers, and a supporter of this community. And without further ado, I think we're going to have a little ribbon.
Yeah, Michelle stole my scissors.
She did?
So I don't know what she did with them. Yeah, we brought the big scissors today. So again, thank you to MAHEC for choosing McDowell County to put a facility like this in for folks to come in and get some dental care. And I think it's exciting about the possibilities for the growth. There's somebody in the room, Mr. Chuck Abernathy, that would love to bend your guys' ear about opportunities for growth here in McDowell County. We're open. We may be a rural county, but I think we're very visionary in what we do. We're very big in what we try to accomplish. So we welcome you guys, and we welcome the challenges, and we're here to support you, and we'll continue those efforts. So thank y'all very much. So without that, we'll let's get
So
a.
if we can get the dental folks, Dr. Heck, and the county
Yeah,
folks,
we'll get the county folks
as
up
many
here.
people as will fit behind the ribbon.
Chuck.
Some folks from the county, can you come join us, please?
Yeah. Come on, Chuck. And Clint, Bob. Please.
Where's your little scissors there?
I got the big ones.
You think these little guys are gonna work?
These actually cut.
There you go.
That's awesome.
I'm glad you have occasion to use it.
I'm gonna let you guys have it. Can I move a little bit, please? Yeah, that's awesome. Slide in there. Yeah, I'm good.
Come on, come on.
Bring my team.
There you go, please. There we go, ladies. Let's get this down. Tall guys.
There you go. Where's Miss Michelle? Michelle, you tell us what we need to do.
I know. Oh, it's such a
You just cut it.
Yeah. If everybody can take a step forward, don't cut it yet.
See, I know about you, but I've learned.
Uh-huh. Great. Anytime you're ready.
There you go.